So good afternoon, my name's Dr Hume Rendle-Short, I'm a GP in Toowoomba, and this short snap I'd like to talk about the term, a little bit about the concept of the so-called difficult patient, and I guess just give what to me was a new lens or way to view these patients and these situations. And I want to start off by saying that I actually don't like the term difficult patient. I think it carries connotations with it that I prefer, so I try to avoid that term as much as possible. I use alternative terms like the patient with complex problems, or possibly even the patient with difficult problems. But I guess I want to move away from the idea that the patient is a potentially difficult person, because I just don't see it that way. So after practicing for almost 30 years, it was only about 4 or 5 years ago that I came across a concept that changes my view to this whole situation, and it's sort of a lens by which to look at this particular clinical scenario. And the concept is basically that whenever we have a difficult clinical situation or a patient who typically is called that difficult situation or that difficult clinical thing, that the underlying problem, I would say 9 times out of 10, I'd say 99 times out of 100, the underlying problem is fundamentally this: that my agenda as the doctor is different from the patient's agenda. Now, it might be that my agenda is different from the family's agenda, or indeed sometimes from the nurse's or the specialist's agenda. But fundamentally the underlying problem, almost always, is that my agenda is different from the agenda that's sitting in the room as presented by either the patient or their representative. And I guess what I would sort of challenge or invite you to do is, next time you have a clinical situation in which you feel uncomfortable and you are tempted to use the term difficult patient, which I don't use anymore, but when next time you have that clinical situation, to ask yourself the question, to reflect, what's going on here? What's my agenda? What's the patient's agenda? And is in fact the problem that we can't meet up with our agendas? Then I would challenge you or suggest that you go on to the next step, which I now do, and that is to say to myself, as I'm consulting the patient, or as I'm sort of thinking there, where am I going to go next in this situation that's becoming tricky, is to ask yourself the two questions. Hey, what's my agenda here? What's the patient's agenda? Where is that mismatch? And sometimes then, if you turn your conversation around and actually put that out on the table and start to explore what is the patient's agenda, and maybe put that out on the table and say, look, this is what I think's going on here. This is your agenda. Or this is what you think should happen, or this is how you want this situation to pan out. And then at the same time, start to put your own agenda out there and say, look, as a doctor, this is what I believe I need to do. Whether that be investigate more thoroughly or introduce a medication or whatever. I guess it's just a thought. It's just a way of looking at your consults, and I call it sort of a window or a magnifying glass through which to look at those potentially tricky clinical situations. And over the last 5 years, I've found it very, very helpful, and I'm amazed that for 30 years I didn't actually twig to this reality. Thank you.